Hello and welcome to our look ahead at what the papers are bringing us tomorrow. With me are Madeline Grant from the Telegraph and Sonia Sodha from the Observer. Lots of the front pages are in already. Let's have a look. The Guardian goes with the coronavirus, reporting government contingency plans to pull police officers off investigations in order to deal with the epidemic. The Times says patients may need to be seen by video to free up doctors' time to deal with the virus. The FT focuses on the economic cost of the crisis, leading with the emergency rate cut by the US Federal Reserve. And the Metro has a picture of the Queen wearing white gloves while presenting a medal as a precaution against spreading the illness. The Mail carries the same picture and says that people may have to put their social and work lives on hold for 3 months as a result of the outbreak. The Eye also reports on the government's plans, saying that in a worst-case scenario there could be 500,000 extra deaths in the UK. And the Mirror says the Crown Prosecution Service is reviewing its decision to pursue a prosecution against Caroline Flack. Let's have a look at some of those stories in more detail. Let's kick off with the Mail. And Sonia, this picture of the Queen, which has been pretty popular on the papers, and their headline, "Life on hold for 3 months."
That's right. So the picture of the Queen is she's giving honours at Buckingham Palace, and apparently it's the first time she's ever worn gloves to do this at a palace investiture, it's called.
Well, she wears gloves a lot, doesn't she? But
she does wear gloves a lot, but usually sort of not indoors pinning medals on people, I suppose. So I guess it just is a striking image of how it's affecting, coronavirus really doesn't it affects everyone. And we've seen that in Iran, where you saw the deputy health minister fall ill. No one is completely immune from it. So it shows that even the Queen is taking public health measures. So perhaps it sort of sets a good example to the rest of us. But the key story really on the front of the Mail and a lot of the papers tonight is about the government's action plan. So what it would do in a worst case scenario. And there's been a lot of criticism of the Prime Minister in recent days, a bit like, where is he? Why did it take him so many days to chair the first Cobra meeting, which was yesterday morning? But he really did sort of come out all guns blazing in a press conference today with lots of public health experts around him, chief medical officer, chief scientific advisor to the government, and really set out the details of the plan. And that's what a lot of the papers have splashed on. I think it's worth stressing it's a worst case scenario that we're talking about. So a lot of the plan focuses on what proportion of workers could be off sick. It's 1 in 5. What would happen, for example, to the police? They would be held off investigating even quite serious crimes like murders while this is going on. The army might be drafted in. What's going to happen to the NHS? What are people going to be advised in terms of working patterns, social
and that
plans?
that plan is online, Madeline. It's worth reading, I think, isn't it? The government have published the outlines of it, and they are preparing the public, aren't they?
Yeah.
Without wanting to cause panic.
Well, it's a very tricky balance to strike, isn't it? Because on the one hand, if you over-egg the pudding too soon when there is still a limited number of cases, you risk doing things like, for example, spooking people and encouraging people to, go and clog up A&E before that's necessary, and change their activities and potentially destabilise the entire economy. But at the same time, it is worth preparing for every eventuality, which is what I think they're trying to do here. Matt Hancock, in his statement earlier today, said that they were preparing for the best, but kind of working towards preparing for the worst, but sort of working towards the best.
Yes, and the Mail's 3 sub-headlines are NHS at highest threat level as UK cases rise, 6 million workers could be all off at once, and even eating out and shopping may be under threat, which is a curious phrase.
It is. I think some people will look at this and think, oh gosh, if that's the least of it, it's not going to be that bad. But I suppose the sort of economic point is that there's going to be so much disruption to the economy. And so parts of the service sector, like restaurants, hotels, shops, there's definitely going to be an impact if people are being advised to stay at home, not to socialise too much.
Let's just move on to
but there might be some winners, things like delivery services and so on.
If drivers are allowed to get... The Guardian has got, a pretty serious take on this. Murder inquiries to be axed if virus hits police numbers, and keeping basic law and order and making sure that it isn't just the most serious crimes that the police respond to, but they can, respond to the things that we expect them to, is pretty important, isn't it?
Yeah, absolutely. And they're also preparing for a situation in which many officers are stricken with this illness, just as it may well be the case that the army and police are having to be drafted in to take over some of the functions some of each other's functions and ensure that normal stability continues.
And they are talking about, yes, some police investigations into homicides halted and 999 response times extended.
And I think this is a thing, isn't it? You sort of think of your emergency services being there in a situation like this. But of course, if it was the worst case scenario in terms of the numbers of people being infected, the number of people being told to self-isolate and stay at home, if schools are closed, for example, all of our nurses and doctors and police officers, lots of them are parents and have kids. So actually, kind of the issue is that the ability of the emergency services and health services to respond will be themselves impeded by staff shortages. And that's
the thing that's very, very important to remember, it is the elderly, isn't it? And the idea of whether the elderly have to be isolated or we all have to keep away from elderly parents and relatives, because that's where the mortality numbers are higher.
Yeah, absolutely.
That's really going to be where it cuts.
And I think it's particularly worrying, if you've got parents or elderly relatives that sort of get regular care from professional care staff, and what happens if your parent's care worker has to stay at home and self-isolate? What's going to happen to your parents' care? What happens if there aren't just enough care workers? And you're being told lots of questions.
But I also think what happens with kids at school will be very important, because the moment they decide to keep kids at home and not going to school, you've suddenly brought the entire economy to a halt, because there are many, many parents that will then struggle to find childcare. So I think the point.
That's why in the briefing this morning they were really not wanting to stress that.
I think that would be very much the kind of nuclear button that you would only press if it got to a really critical situation, and they would want to avoid that at all costs.
And the FT obviously has the economic take. They're talking about the Fed and this half-point rate cut. The first time I think they've taken an emergency rate cut since the peak of the global financial crisis, which is incredible, actually, isn't it?
It is quite an extraordinary measure. It does sort of have the air of, panic about it in a way, and it doesn't send out a particularly strong message of confidence to the economy at this time. One does sort of wonder if there's something that the American markets know that the rest of us don't, in a way.
And just sticking with the US, because let's move on to The Independent. They've got a picture of Bernie Sanders casting his vote. Super Tuesday primaries overnight tonight.
Yes.
It's a big night, isn't it?
Very big night.
It will whittle down, I think.
Yes. So it's the night when I think 14 different states declare, including California. So it's hugely determinative in the ultimate result. And it's, increasingly seems to be a two-horse race between Biden and Sanders. And it's an interesting one in a way, because in one candidate you have conformity, you have something much, much closer to Hillary Clinton, but of course we know that Trump beat Clinton already, and it may well be that when you have a slightly more extreme candidate in one way, that you fight fire with fire, and someone like Sanders would do much better. Who knows?
And the Bloomberg factor?
Well, I think that's going to be interesting to watch, because Michael Bloomberg has sort of played it so differently from presidential nominees in the past. He's entered the race very late. These are the first set of primaries that will have any results in. He decided to give states like Iowa and New Hampshire a complete miss. Partly he could do that because he's so rich and he had a lot of money to fling and has been running all these huge, very expensive, nationally aimed adverts.
I mean, but
he doesn't, a lot of people, I think, thought that he might have a certain momentum around him, and in the polling, it's not quite clear that that's coming through. So I think it is interesting that really, Sanders is absolutely the leading left candidate, and it's very hard to see how he's not in the race till the end. I mean, he will be in the race till the end. But there have been a lot of question marks about, well, will his main contender be Bloomberg or Biden from the sort of more centrist wing of the party? And a lot of people thought for some time it might be Bloomberg, but actually it looks like the dial has swung back to Biden.
Yeah, Biden polls much better amongst African Americans, and actually for all the money that Bloomberg has thrown in all directions, it has done very little good. And the difference between him and Trump was that actually Trump raised most of his money from small-scale donations from less wealthy people, whereas so much of Bloomberg's cash has just been his own money, which seems to have done very little good indeed.
It's striking also that the three potential front-runners are not very young white men.
Yeah, I think that's right.
And, if you look at the resurrection of the left, often we link US and UK politics, don't we? And both have been in the doldrums, frankly, here. And they're, out of office, out of power. How much is the Labour Party here looking? I mean, the Labour Party always looks to the Democrats,
Well, it's interesting, isn't it? Because I think actually actually there'll be a lot of people in the US who've been looking at what's happened here around the general election result at the end of last year and Jeremy Corbyn and thinking, well, what does this mean for us as Democrats? So in some ways,
an unfair comparison?
Yes, I actually think it is an unfair comparison in the sense that I think Bernie Sanders isn't Jeremy Corbyn. I think Sanders has actually achieved a lot of stuff in American politics. He's shown an ability to compromise. He's got stuff through the Senate in a way that Jeremy Corbyn simply hadn't in British politics. So I think although they may have similar messages, it is a bit of an unfair
But Madeline, is
comparison.
Middle America going to vote for Sanders,
Well,
given the choice, if that was the choice on the ballot?
I think they'd be more likely to vote, particularly when you look at the ferocity of the culture war going on in America, where actually economics is obviously part of the equation, and Trump did so well by essentially saying, no, these jobs are not gone forever and I can bring them back, and then taking steps to ensure that some of these jobs did indeed come back. So obviously economics is part of it, but actually I think the culture war transcends those politics in a way, and you almost need someone who doesn't sound like a conformity Hillary Clinton candidate in order to beat someone like Trump.
And I think it will be the real test. If Bernie Sanders is the Democratic candidate, it will be a real test in the US. Can left populism work against the politics of Donald Trump? Clearly didn't work here in the UK, and some people say, well, that's actually because Jeremy Corbyn was just not the candidate to do it. He just wasn't good enough. Bernie Sanders is, I think, considered to be a much better sort of proposition to voters, and there are certainly, if you talk to people who are out canvassing for the Democrats in the US, people who say, oh, well, we've spoken to people who voted for Trump last time and who would vote for Bernie Sanders this time. Will that play out in a general election? I mean, only time will tell if Sanders gets a nomination, but I think it's a big test for kind of the left. Will it work?
The thing to remember with Corbyn, I think, is that actually if you look at the polling, large swathes of the public agreed with much of his policy platform. They loved Corbynomics, but they just felt that he was individually completely uncredible as a candidate, and so they just didn't trust him an inch. And it may well be that someone like that Sanders commands greater loyalty amongst the voters.
We will see. We will see. It's going to be an interesting night. We'll find out more tomorrow morning. Just on The Guardian now, and this is a very interesting healthcare story, Madeline.
Yes. So it's the story that women going into labour are frequently being refused an epidural to alleviate their pain during the procedure, and extraordinarily, a representative from BPAS reports that pain relief is sometimes being treated as a kind of nice extra rather than an essential part of the procedure. And it's quite interesting that this particular belief, as I understand it, seems to have proliferated recently because there's been a kind of the advent of a kind of sort of Earth Mother style approach to these things, in which they seem to look upon pain relief as with suspicion.
I mean, it does seem extraordinary that they're saying women in labour are being actually refused epidurals, which is in breach of official guidelines.
I think this will chime with a lot of women, like from women that I know, even my friends. Epidurals are not looked on by some midwives as the sort of thing to do, and there has been, as Madeline's just said, this sort of natural birth ideology, which actually, if you look at investigations into mother and baby deaths in Telford, in other hospital trusts across the country, that has been found to be associated with poorer outcomes for mothers and babies, unavoidable deaths, because actually there's been a resistance to medical intervention in childbirth. And I don't think it'll be a surprise to a lot of women that you're basically expected to grin and bear it as a woman, and pain relief, no, thank you, that's not really for you.
Teaching.
So it's, and this is an official government study, so I think there'll be a lot of anger about this, actually.
Well, I've never had children, but I'm very sure that if it ever happens, I will be demanding that epidural with every fibre of my being.
I had a caesarean for mine, but anyway, so I didn't have the chance. Yes, it wasn't totally pain-free, I have to say. Sonia, Madeline, back with more very, very soon. Thanks very much indeed. We'll be back in half an hour and have a look at a few more front pages, and in the meantime, of course, it is all there online for you as usual. If you've missed anything, it is all you can catch up, of course, on the iPlayer. See you soon.